and joining us for, oh, there she goes. So
Excellent.
it's just Layla. Thank you for Dr. Kahana. I can do that too. Well, I want to thank you for coming. Welcome to TED Community Organization TED EDU series. My name is Layla Lohmann. I am a dentist, wife, mother, TED patient, and host of the TED EDU. Today, I'm talking with Dr. Alon Kahana. He is an internationally renowned expert in the orbital ophthalmic plastic surgery at Kahana Ocular Plastics and Orbital Surgery. This is a destination clinic for patients throughout the Midwest and beyond, offering the latest surgical and non surgical techniques with a deep understanding, in particular, of thyroid eye disease. Part of Dr. Kahana's commitment to excellence is innovation and the opportunity for patients to participate in regular patient centered forums that help educate and engage patients. That type of support helps families and caretakers as well as patients. We at the TED community are particularly interested in Dr. Kahana's comprehensive approach to treating the whole person and not just the disease. So today we're going to talk about TED, quality of life issues, and a role that self-care plays in the TED patient's healing journey. Dr. Kahana, welcome. How are you?
Thank you very much for the very kind and generous introduction. Um, I'm happy to be here, and you're right. I have done this in different types of crowds, with just a few individuals to as many as literally thousands, um, and um, and everything in between. But usually it's dozens to hundreds at a time, and then facilitating discussions because the real work happens after you. I might introduce people, bring them together, but just like here in Michigan, there's now um, a group, kind of like a club that supports each other. People come together. Sometimes they borrow the reception area in my office on Sunday afternoons to meet. Other times they'll do something else. They connect on Facebook. This organization is a way for people to connect across the country, and now Europe also, which is pretty cool. This is a
Yeah,
global problem. There's a disease, thyroid eye disease occurs on every continent, in every ethnicity. It is significantly affecting women more than men, just like all autoimmune conditions. And it has what we call a bimodal distribution, meaning it's younger women and then middle-aged women. It is uncommon for people over 80 to get it, but I actually have some patients who got it in their 80s and even 90s.
yeah.
So the female
What's the
preponderance,
youngest? What's
the
the
youngest,
youngest
oh,
age you've
five,
ever?
five,
Wow.
5 years old. Yeah, so it's very uncommon to have Graves' disease in general as a child, but it occurs. And we can talk about the rise in autoimmune conditions in general in this country, which is leading the world in the wrong way in autoimmune conditions and how it's affecting our children in particular. But then thyroid eye disease only occurs in a fraction of the patients who have thyroid Graves' disease. And those patients usually at one point or another will be referred to me because I do oculoplastic and orbital surgery in general, but I'm one of the few people in the country who also particularly specializes in pediatric oculoplastics, not just thyroid, but congenital ptosis, congenital deformities, trauma, cancer, pediatric orbital cancer. And so I do have patients all across the country who have those issues because a lot of people don't want to take care of kids. But anyway,
Yeah. Well,
that's the
it's
gist of
they don't want to take care of kids because it's scary if you get it wrong. It's a little bit of fear of the unknown.
but yes, and it's hard to examine kids. You never really examine kids. The way that you examine kids is you play with them, and they don't know that you're examining them. You're playing hide and seek. Yesterday, I was playing with this 2-year-old boy came with his cars and trucks, and so we were playing with his cars and trucks. And while we are playing, I'm looking at his eyes, right, trying to
Yeah.
figure out which eye is tracking, which eye is dominant, which eye is using, which eye is not, which eyelid is working, etc. And also, you need to deal with the parents, and I'm a parent of
Yeah.
children, and you're a parent of 3 children, and whenever you take care of a child, you're taking care of the whole family.
Yeah.
Um,
Mm.
And just like when you take care of an autoimmune patient, you take care of the whole body. The autoimmune condition might manifest in a knuckle or an eye or a gut, but it's actually everywhere. And you're
Yeah.
just seeing certain symptoms in a particular organ system, but it's throughout the body. Realize that the immune system is throughout the body, so the autoimmune condition is throughout the body. And I'm a big believer that you have to take care of the full body, not just the uh, the disease symptoms themselves. We have a new person just joining us. Oh,
Yes.
very good.
Thank you. Thank you. Well, speaking of the whole body, how do you define quality of life specifically with, I know, you deal with all kinds of autoimmune diseases, but specifically with TED, how would you define quality of life as it relates to someone who's diagnosed with that?
Well, so the thyroid eye disease affects so many different things. So let's start talking about the most basic, which is living without pain.
Mhm.
Pain, when I blink my eyes, I don't feel my eyes. I don't know that I'm blinking my eyes. Someone with either thyroid eye disease or a more aggressive form of dry eye, every time they blink, they know they blink. It's like someone who has a headache. I don't feel my head, but people who have chronic headaches
Mm.
feel their head. And
Exactly. Yeah.
yeah, and it becomes something that you need to deal with every day.
Yeah.
Uh, and it impacts your quality of life because it's one more thing, right? We need to eat, we need to sleep, we need to work, we need to take care of one another. You have family responsibilities, you're a friend, all the things that you do. And then on top of that, you need to deal with the eye pain.
Yeah.
And then
Yeah.
let's say, yeah,
I was
sorry.
gonna say I equate it to no apologies. I equate it to sand or an eyelash in your eye, and when I try to emulate what it feels like, I'm like, just imagine like a sand get in your eye, and then you have that all the time. It
Right.
always feels like you have sand in your eye, or you always feel like you have an eyelash in your eye. So it is not something people commonly realize. Like I do feel my eyes, and that's a good anecdote with your head and that chronic headache too, because
It's
everyone can relate to that.
and it's the chronicity that's the problem. If I take my hand and I tap, right? I tap on my hand. That's not painful. But let's say that I do that for an hour or for a whole day. Pretty soon, I'm going to have raw skin. And if I do that for a week, it's going to bleed,
Yeah.
right? So it's the chronicity. People can deal with a headache once in a while or an eyelash scratching or a scratch in their eye, and then it goes away, it gets better. The chronicity of the thyroid eye disease is what really impacts quality of life. So pain is one issue. Another is vision, right? Do you
Mhm.
have good vision? Can you see? Can you see single or do you have double vision all the time? Or do you have double vision only when you look to the side, but you need to look to the side to drive, or somebody calls you from the side and you look at them and suddenly, and in the gaze where you see double, oftentimes will cause some pressure pain around because it's the muscle that's pulling. And so suddenly you're kind of afraid to look. So you turn your body and you turn your head, and then people who don't know are asking, "What's wrong with your neck? What's wrong with you?" Or your eyes are crossing. And we all know that when we talk to one another, we look at each other in the face and in the eye. And people who have strabismus, which is a condition in which the eyes don't move together, they got a term for that centuries ago that basically is shifty-eyed. Now think
Oh,
of what the term shifty-eye means in a
yeah.
medical term. You're dishonest, you're
Yeah.
untrustworthy because you're looking in one way and you're looking in the other way. So the stigma of that is enormous, aside
Yeah.
from visual debilitation. Um, the inability to have self-fulfillment because you can't do the things that you love to do. Um, the ability to engage, whether it's in work or in hobbies or in gatherings, family activities, etc. And then just having general confidence.
Mhm.
Yeah.
In addition to taking care of thyroid eye disease patients and kids and all of that, they also do cosmetic surgery. And the majority of the time, the main reason for it is the person who's aging. We all know we age, right? It's better to age than not to age.
Yeah, that's right. You're
Right?
alive, so
You're
get it.
alive.
Yes.
But when you look at yourself in the mirror, you want to see you.
Mhm.
And when you look good, you feel good and you feel
Yeah.
confident. And the confidence becomes something that, consciously or subconsciously, everybody notices. What we consider as charisma oftentimes is a measure of confidence. If you're confident, you're going to be charismatic and people are going to want
Sure.
to be around you. And if you're not confident, then that's off-putting. And a condition that impacts people's confidence is really going to impact their quality of life. I think that it's important for everyone to be aware, right? The first step of agency, where you can take control of what's happening to you, is to have insight that
Yeah.
this is going on. I don't just have an irritated eye, I have thyroid eye disease, which is a particular kind of irritated eye. And while there are things I can't change, um, your age, your gender, etc. But if you live in a low sunshine condition, like here in the northern Midwest, you need to take vitamin D supplementation so that your immune system is healthy.
Yeah.
You need to get out of the house and walk around and not just be a couch potato, so that your blood is flowing and you're burning calories, etc. So there are some things that you take your medication on time. It, people oftentimes don't know how to take their thyroid medicine because the endocrinologists are oftentimes really good at prescribing it, but sometimes it's not that something is lost in translation with regard to the thyroid hormone medicine. So for example, levothyroxine, you need to take it on an empty stomach, 45 minutes to an hour before you put anything in your stomach. You can't take it with anything else because then the absorption is going to be unpredictable. If you miss it, if you miss a blood pressure medicine, you skip it. If you miss an antibiotic, you skip it. If you miss levothyroxine, you don't skip it. The next day, you take a double dose.
Do you feel like the providers need to be understanding that they need to tell us this? Because how is someone with thyroid eye disease supposed to know when something happens? Because just like you said, typically with other medications, you feel confident in saying like, I'll skip it, I'll get it fine, I'll get it another time. So how do you feel like patients should be more confident in asking their doctors questions that they don't know?
So you don't know what you don't know. And that's the onus on that is not really on the patient. What I would say is that if a patient can bring a friend or a loved one with them to doctor's appointments, that will help a lot because it's very hard for a patient to remember everything that goes on. It's great to have another person with you. Take notes. Tell the doctor, is it okay with if I'm taking notes? Um, get access to your portal. Most of us now have electronic health records. Our patients are able to log in. So
Yeah.
get access to your portal so that you can review. You might call afterward and say, hey, there's something in my note that's wrong.
Yeah.
Um, and it can be fixed. So one time, we're talking 30 years ago, almost 30 years ago, I got denied for life insurance because my PCP put my weight as 270 instead of 170. It was a typo. But then that put me in a completely different life insurance category, right? It was just a typo. So this
So
are things that where we as patients can have agency. There are things where we can be proactive, but explaining how a medication should be given, that's in the doctor and in the pharmacist. And by the way, the pharmacist is oftentimes there specifically to answer these kind of questions. If you didn't have a
yeah.
chance to ask your doctor, when you pick up the medicine and the pharmacy assistant asks, do you have any questions for the pharmacist? It's absolutely fine to say, yes, I do.
Yes,
right?
but people don't like to be a burden, and people have their own self story in their head, and they just, I mean,
Right.
we want guidance. So, specifically speaking, it's another topic, but do your patients typically confide in you about isolation or depression or anxiety? Do they do that
So
in your practice?
the answer is sometimes, but I ask about it proactively.
Okay.
So the things that work against it is patients feel shame about their negative feelings about themselves. And women, this is a female preponderance disease. Women beat themselves up.
Yeah.
They don't like to share their doubts and weaknesses, certainly not with a guy.
Because it makes you vulnerable. I mean, if you're a woman and anyone who's on here realizes, but
That's right.
it's not a weakness. So, yeah.
And for men, it works the same way. It's different, but a guy, I'm not gonna ask a question. Doctor might think that I'm depressed or stupid or whatever.
Yeah.
Men are particularly bad at connecting with their feelings and their experiences. And so
So, how do you counsel them? Yeah.
I ask, how are you doing? What are your hobbies? Here in Michigan, we talk football. We'll
Yeah.
talk outdoors. We'll talk hiking. We'll talk, going up north to the lake, boating, etc. Ask them about things that they might be engaged in. They'll say, well, ever since this started, I'm not really leaving the house. Well, that's a warning sign,
Yeah.
right? And why is that? Well, I'm in pain all the time, or I don't want people to see me this way. I'm wearing dark glasses all the time because I'm light sensitive. I can't go to the lake. I can't be on the boat. It's sunny and I'm light sensitive. Um, and so that's there is not a fix for that, right?
Sure.
The feeling. Um, the first step is to validate it. You have good reasons to be unhappy and having pain and feeling uncomfortable to be out and about. But there are things that we can do to help the underlying issues so that hopefully you can resume doing the things that you love to do. And by the way, I am confident that we can make things better. I
Yeah.
am confident that we can make things better. And if we partner, if I'm going to make recommendations, we're going to figure out what would work for you. Um, if your endocrinologist is not hearing what you're telling them, I'm going to call them
Hmm.
and we'll figure out maybe the levothyroxine is not working. Maybe we need T3. Maybe we need a combination. Um, maybe the TSH of 3 is within normal range, but it doesn't work for your symptoms, right? You don't treat a number. If a person feeling sluggish and the sleeping is sleeping too much, or the sleeping is not consistent, the energy is not there, maybe a TSH of 3.5 is not right for you. You don't treat the number, you need to treat the person. You need to ask them about what's going on with them. And oftentimes patients are not feeling empowered to have that conversation with their endocrinologist, but I am, and I will. And whereas 25 years ago, my endocrinology colleagues thought that I was kind of a pain. What is this eye doctor doing, questioning what's going on with this endocrine condition? They now know me for decades, and they know my research, they know my work in the area. Next week, we are doing a big event for physicians, targeting especially endocrinologists and eye specialists in the Detroit area. And I have an endocrinologist and an endocrine surgeon working with me. And we're inviting everybody to dinner, and we're going to talk shop at a high level, at the high level.
I
And just about 6 weeks ago, I had a patient from another healthcare system who had had radioactive iodine. Her thyroid hormone levels were fluctuating terribly, and she had pretty high antibody titers. To me, that means that she has residual thyroid. We can test for that. So you do a thyroid uptake scan. But caveat, normally with a thyroid uptake scan, you stop the levothyroxine because you want the thyroid gland to be needy of all the iodine tracer that is going to show the uptake. But if you do that, TSH will go up and the eye disease can get worse. And so you do the radioactive uptake scan of the thyroid without taking them off of the levothyroxine. And so she went to her nuclear medicine, the endocrinologist. I told her this. She went to the nuclear medicine doc and he said, no, 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 we need to take them off the levothyroxine because that's the textbook. So then they challenged me and I said, okay, I'm going to connect you with the nuclear medicine specialist who's the head of the program in Cleveland, with whom I did the research on this 15 years ago. And she convinced him that, yes, indeed, for thyroid eye disease patients specifically, for that subpopulation, the traditional standard protocols do not apply because you're going to end up worsening their eye disease. And all you need
Yeah.
to know is their thyroid, residual thyroid. And if there is, then that takes you in a different direction. You need to treat that. So there's a lot of things that can happen on our end as physicians, and finding a specialist who spends literally most of their waking hours thinking about this disease. There are not many of us, but
Right.
there are
And
some of us that do this all the time. And we can be and are advocates for our patients
so it
with
sounds like you as a provider are very confident in thyroid eye disease. What is something a TED patient can do in their own journey of healing that they can participate in? Because as a provider, you're giving us all this knowledge, and not all of our providers are like you. So, everyone typically on this webinar are TED patients trying to figure out how to be that confident
Right.
person to either have the conversations with you like you who you are, and we'll be probably told several times that's not the right way. So now that we have you as a resource, I will definitely plug you in the tedcommunity.org so that we can send them over to your research. But specifically for those TED patients, what can they do to participate in that journey, whether it's through healing and self-care or being a confident
Right.
patient to their providers?
Well, this kind of a community like what you and Christine are leading, I think is step one, finding other people
Yeah.
who have gone through the journey. And it's amazing to me how many of my patients, once they get through, say, if you have anyone who to wants help, wants to run things by me, I'd love to help. So
Mm.
that's very heartwarming to see how committed people who have gone through this multi-year process of trying to regain their life are then
Yeah.
willing to give back to the community in terms of sharing their experience. So I think that's step number one. Two, the people like me who are really passionate about this disease typically make ourselves very accessible. I mean, my patients
Yeah.
here in Michigan, they have my cell phone number. The parents of the kids who come from all over the country, they have my cell phone number. They'll text me from New Jersey or from Atlanta, hey, blah, blah, blah happened. What do you think? Or whatever. It's easy to send me an email. You go on my website, it's info@drkahana.com. It comes to my practice manager, and it gets routed to me. My website is essentially a textbook on thyroid eye disease. There is pages and pages of information about thyroid eye disease, but there's also videos. I even did orbital decompression surgeries on a cadaver with a
Ah,
5 camera, high definition recording with professional audio. I
no.
narrated everything. And
Christine,
so,
could you mute that person, please?
there's, because it's a cadaver, you think disgusting, but it means that there's no blood. So you could actually see what's going on. I also have videos on
Yeah.
YouTube where I'm doing it in real patients where there is blood. Um, but in a cadaver, there's no blood. And it's actually meant for surgeons because I have people from all over the world coming to observe how I do orbital decompression surgery so that they can learn and take it back to their home countries in Eastern Europe, in Brazil, in the Middle East, wherever it might be, in Germany. There are not that many orbital surgeons in the world who actually know how to do this because it's at the intersection of orbital and neurosurgical surgeries. So I made the video, but it turns out that my video is viewed not just by surgeons, but also by patients. who
Sure.
are thinking maybe I'll have a decompression. Well, that kind of sounds scary, and it is a little
Yeah.
scary, maybe a lot scary. So it's reassuring for them to actually, it's empowering to know exactly what's going on.
It sounds like your website is great for both the professional aspect, but also the patient aspect. And you focus a lot on health and wellness. Is there something specific that you could discuss about either nutrition? I'm going to take it from super science to practical,
Yes.
about like exercise and nutrition. And I'm talking, don't tell me to work out 7 days a week. Nobody's got time for that. That's a perceived lack of time. However, in your professional opinion, somebody living with thyroid eye disease, what's the minimum amount of stuff we need to be doing in order to get our disease under control?
Right. Ah, well, diet and exercise, right? All of us, irrespective of what our health situation is, would benefit from diet and exercise. Um, but let's first of all look at diet. Our eating habits in general in this country are not good. Um, Even when we make home-cooked meals, oftentimes we are using preserved this and preserved that. Realize that what you put into your body is really, really important because your gut, your intestinal system evolutionarily predates your central nervous system by hundreds of millions of years. Your gut has its own nervous system, it has its own immune system, and it drives the rest of it. So if you put things in your body that cause the immune system to react, then the rest of your body will react. And you probably know that there are some foods that you eat that, boy, you love it, but then it makes you feel not so good. It makes you feel sluggish or
It tastes
sleepy.
so good. It
That's
tastes
right.
so good.
Realize that the people who make that food are counting on you coming back for that food. And food science, they learn to manipulate the food, just like in Las Vegas, they learn to manipulate the lights and sounds to get you
Yeah,
come back to put another quarter in the slot machine. It's that excitement that they build up in Las Vegas. It's the same thing with your kids and video games. The video
yeah.
games are designed to get your kids hooked. The food is designed to get us hooked. So the first question that I think people should ask is, would my great grandmother recognize this piece of food? If the answer is yes, most likely you're in the clear. If the answer is no, or maybe, then you need to ask yourself, do I really want to eat this? Um, there's the
Are you
home,
suggesting though that if the whole food science, if it's going to cause inflammation with somebody with an autoimmune disease, it will make your condition worse? Or is it, again, everything in moderation? The dentist in me is everything in moderation, the oral cavity. But,
right.
specifically with TED, this already ruins a lot of social things and a lot of, emotional, to not enjoy ice cream because of insert whatever excuse it's going to cause it to be worse. Like, what's a reasonable thing that you can still enjoy the food that you want, but be nutritious at the same time?
Well, if you get one scoop and not three, if there is a dairy-free option, consider getting that once in a while. And let me
Got it.
explain. Um, Cow milk has proteins that are very similar to the proteins in our body. When you eat that, usually it passes through your body just fine, but every once in a while, your gut's immune system will react to the cow protein. Okay, not a big deal. It's a cow protein. But because it's similar to our own protein, there is some cross reactivity. And so, if for whatever reason something triggers that particular antibody producing B cell to start
Got
producing
it.
that particular antibody again, it might see a protein in your joint, in your orbit, in your gut, and attack it because it thinks that it's the cow protein. It's just
Yeah.
similar to the cow protein. Um, and so you want to minimize those situations where you're introducing food into your system that will trigger a potential response. And it's not food allergies. We're not talking about histamine release and all of that. We're talking about true autoimmunity and cell-mediated immunity. And I do think that moderation is key.
Yeah.
So when you to induce activity by the immune system, for example, if you're giving a vaccine, you don't introduce a little bit. A vaccine is based on giving a lot. Giving a second agent that triggers the immune system. Usually it's something like LPS if you're doing it in the lab, like a phospholipid, but something that will trigger the immune system, and then you repeat it again a month later or 3 months later or 6 months later, and then you repeat it again. The point of it is excess repetitive exposure. That's what you want to avoid with things that are not your caveman type of situation where we have literally a million years of evolution, more, to digest it. Things that are more
Got
recent,
it.
our body is not yet evolved to deal with it, and so that's an issue. Also, if you gain weight, above us, our fat in our body is extremely endocrinologically active. And so think of it as another gland, and you're making that gland bigger and bigger and bigger, and that impacts all the other glands.
Yep.
So that's
We
the
have
age
about 10
diet.
minutes.
Yeah.
Okay, diet. We have
Um,
10 minutes left.
sleep
Was
and
there, well,
sleep and stress. Can we talk about sleep
okay,
and stress?
please.
You're a busy career woman and a mother of three.
Mother of two, but yes.
Mother of
I
two.
feel like my husband is one, so you're
That's
okay.
correct.
David is also one.
That's right. And do you have a pet?
I do not.
Okay. If you do, that's another child, right? And
Correct.
so, and I would say that in particular, this is true for many women I know, is that all their responsibilities come ahead of themselves,
Typically,
are
yeah.
very service oriented in their
Yep.
nature and in their upbringing and the way that we socialize girls and all of that. And so if you don't make yourself a priority, it adds tremendous amount of stress because then you're trying to do all these different things. And stress drives stress hormones and adrenaline. And we know that stress hormones drive autoimmune activity.
Right. It's a trigger.
It's a
So
trigger.
basically, if you're not sleeping, you get more stressed. It triggers your condition to feel worse,
Right.
correct?
Correct.
Okay.
And your condition actually does get worse. You can actually measure inflammatory markers. Um,
But not, you can't do that. I mean, you can do that, but we can't measure inflammatory markers on a regular basis. So if you were going to talk sleep and stress on a practical level, I'm going to bring it back down one more time.
yeah.
What does someone who lives with a chronic health condition, specifically TED in our case, what's a reasonable amount of time? Like you would say you would recommend X amount of sleep. And if you can feel yourself being stressed, my opinion is remove yourself from the situation. But in your professional opinion, what do we need to be focusing on with sleep and exercise too?
Well, it's not an issue of the amount of sleep. Everybody's a little different. But
Okay.
if you're exhausted all the time, you're not getting enough sleep. If you need to drink 3, 4 cups of coffee just to get through the day, you're not getting enough sleep. If you
True.
find yourself quick to anger, you're probably not getting enough sleep. Um,
True.
so self-care, realize that if you don't take care of yourself, you can't really take care of anybody else.
Yep.
The truism is that your health is more important than anything else. And you might say, no, no, my children are more important. Well, no, because if you don't have your health, then your children won't have a mom,
Yeah, you can't take care of them. I get it.
right?
Yeah.
And
Yeah.
so you need to actually tell that to yourself. There was a many years ago, Saturday Night Live had Stuart Smalley skits where this
Okay.
guy looked himself in the mirror and said, I'm good enough, I'm smart enough, and gosh darn it, people like me. Self-help. And he was making
Yeah.
fun of that whole thing, but actually, gosh darn it, that's true. You
Yeah.
actually need to tell yourself, I am good, I am successful, I am doing well, I am liked, I have friends, I have a career. I am enjoying a novel. I am enjoying talking with, I call my mom every Sunday or whatever it might be. Give
Yeah.
yourself credit.
Yeah.
And that positive feeling releases endorphins that generate more positive feeling. Whereas if you have negative feelings, that generates more negative feelings. Now, here's a truism. A negative feeling is 5 times more powerful in your brain than a positive feeling. That
Yeah.
is the consequence of evolution in our fight or flight response. And so whenever you have a negative feeling, you need to realize that you need to think of 5 positive things just to balance it, not to exceed it, just to balance it. And if you're someone who wallows, just goes in your
It's
mind
it's
about all.
self-limiting, your self-limiting talks outweigh your empowerment. So you have to do 5 times as much positivity to reach that success. So basically, I have a few minutes left. I just have one more question, but you're basically saying our mind does have to take it. I think one of the issues with someone who deals with thyroid eye disease, and I've spoken to many of my colleagues in the thyroid space, is we have so much destructive, like our pain, our head. I don't like going outside. And so, in your opinion, do you recommend, and in my opinion, I recommend the art therapy, but just kind of going to talk about your feelings so that you can get it out of your body instead of in your brain? Is that something you tend to recommend?
Absolutely. I mean, we have sometimes these kind of sessions in my own practice with my patients, but therapy is amazing, but it's expensive. And it's hard to get a
Yep.
therapist who can deal with somatic conditions. I actually, when I have sessions for education, I've been, for years, I struggled to find a psychologist or a psychiatrist who has any interest in thyroid eye disease patients. They don't, because you can't prescribe a pill. There's no
Yeah,
place
that's
you
right.
can talk. And so this is again coming back to this kind of an organization. You need to have your people. You need to
Yeah.
have your friends and family. Um, and be careful of relying on your spouse.
Yep.
The spouse typically can be there to say, there's nothing wrong with you, honey. You look great. I don't know what you're talking about. And that's not at all what you need. Or, yeah, we're going to solve this problem. We're going to do this. We're going to do that. We're going to do this. No, that's not, again, not what you need. The empowerment comes from sharing, understanding, connecting with your feelings, and then moving forward, not rejecting them, but building on them and moving in a positive direction. And that's something that you do with yourself. And I would say that while it impacts women more than men, women are particularly better at doing that, at not
Yeah, I could see
assessing their
that.
emotions, whereas as men will really close up. But
Yeah, I
men
could see
really
that.
have a wife who's much better at connecting with them and supporting them.
Typically, I have 5 minutes left. I have one question on there from somebody on the webinar, but I also have one more for you. When looking toward the future for thyroid eye disease, in terms of solutions, and there's very innovative research out there. What are some things that you are excited about specifically for thyroid eye disease in the innovation space?
Great question. So there's a lot of attention now to the anti-IGF-1 receptor inhibitors. I use them. I'm very optimistic that they can help people deal with the disease better. We now know a lot more about side effects. We know more about flare-ups and recidivism from there, even if you have a good response. But that's not the solution. We need to block the trigger. Treating symptoms after they've already occurred, after your eyes are bulging, you have the double vision, your eyelids are retracted, you're in pain, etc. Yes, it reduces it, but it doesn't get you back to how it was before the disease.
Sure.
The way to deal with it is to block the trigger that started the disease in the first place. And because this is an autoimmune condition, the solution is going to be some kind of an immune modulator,
Yeah.
something that will block the disease process at the very, very beginning. And there's actually tremendous investment now because Tepezza proved that even though this is an orphan disease, money can be made. Companies love making money, right?
Mhm.
The job is to
Everybody
make
likes
money.
making money. Everybody likes making
Right.
money.
So if you show companies, biotech companies, that they can make money in cancer, they'll invest in cancer. If they think that they can make money in dementia care, they'll invest in dementia care. If you show them that you can make money treating thyroid eye disease, they'll invest in that. And they are now investing in that. And there's venture capital money, and there's biotech money, and some of the smartest people in biology and computational sciences, et cetera, are going into our field. And so I believe that in the next 20 to 30 years, you'll see a revolution. Now, you might hear 20 to 30 years, that's a very, very long time. Well, the research on IGF-1 receptor inhibition for thyroid eye disease started about 30 years ago, right?
Right.
And only
Yeah.
4 years ago was it brought to market. That's just how long it takes.
Well,
But I am
I
very optimistic that we'll figure ways to either block or reduce the trigger so that you'll never get to the severity of the disease that many of us need to deal with.
No, I completely understand. Been living with it for 27 years, so I'm excited about all things coming up. But I want to thank you for your time spending with us, Dr. Kahana, and for all the great work that you've done on behalf of everyone living with thyroid eye disease. I look forward to researching your website. But for anybody who's interested, please visit tedcommunity.org and learn more about the TED Community Organization and participate in our robust list of services that are all free. And if Dr. Khanna has about 5, 10 minutes, we're going to stop the webinar recording and we will go do a little bit of Q&A.
Yeah.